Good afternoon, Red Devils. Thank you so much for joining us this afternoon for an opening presentation regarding the start of school. If we haven't met yet, my name's Matt Frahm. I'm the new school superintendent. I'm replacing Dr. Hicks, who retired midway through the summer. And again, just want to thank you for taking time to be with us today. If you're not able to watch this whole presentation, I just talked with our tech team, and they're going to try to edit down the clip for tomorrow and hopefully get it up on our YouTube account. So if you want to watch it again, or you think that somebody might like to see it, please feel free to pass that along. I also would like to just give a couple thank yous before we get going. Most importantly, to our faculty and staff for all of their work getting ready for the start of the year. We can't tell you how excited we are to welcome our students back a few days from now. It's going to be a great year, and a lot of it has to do with their planning. So thank you to our faculty, staff, our administrators for all their work over the summer. Also to the Erie County Department of Health for all of their support and their partnership. A huge change between last summer and this summer. You probably remember that last summer, the Department of Education, the State Department of Health, had issued really lengthy and detailed guidelines for schools to guide in reopening. This year was a little bit different. We kept waiting and waiting for guidelines. And as you know, I was sending out Friday communications saying we're waiting a little bit longer. And so the Erie County Department of Health finally provided some detailed guidance for Erie County school districts, which was really appreciated. We are thankful that they stepped up to the plate. And then at the end of last week, we did get some guidance from the New York State Department of Health, and it really was in alignment with a lot of our planning. So we're feeling good about where we are and being able to welcome our students back here in a very short while. I also would like to thank you just for your patience and support and partnership. Again, it's going to be a great year. We can't tell you how excited we are to have your sons and daughters back in our school buildings, and it'll be here in no time. So we're going to get going. And we'd put together a slide deck to guide our conversation here today. A lot of the content follows what you might see in guidance from the CDC or the Erie County Department of Health. And what we've tried to do is talk a little bit more about what learning will look like in our learning spaces this year. But we also had taken a lot of the questions that you had passed along in a Google Form survey, and we've tried to embed those here so that we're hitting on some of them that were passed along, in addition to some things that we shared last Friday in a Q&A. Really, that was focused on some of the more frequently asked questions. And again, I would say that after this presentation, if you still have questions, please don't hesitate to reach out to a building principal, to myself, and we'll do the best that we can to get you some answers and respond. So we'll get going. You know, I always think it's important to start with why we're here, and it's for our students. And so we want to make sure that as we plan and we get ready to open, we're keeping kids at the forefront and their safety and well-being at the forefront. And so we want to have a healthy and safe start to the school year. And once that happens, then we can look at some of the different interventions that we're using in some of the existing guidelines and make modifications. If you've taken time to read through some of Erie County's supporting documents, one of the things that they emphasize is that there may be changes over the course of the year. The difference in interventions and what learning looks like is different in some ways than last year. And so we hope that we'll get some data, and when we can make some changes, we'll do that. But at the end of the day, we want to make sure that we're keeping students' safety and health always as our first priority. So I know that for a lot of our students and parents and staff members, the issue of masking or face covering has been front and center. I've had a lot of people reach out via email or via phone call wanting to talk about masking. I know that there's a lot of different thought processes and a lot of different opinions out there regarding masking. But at the end of the day, I just want to talk a little bit about what it will look like here in Clarence this fall. So in alignment with Erie County Department of Health, their guidance, in addition to the requirements from the New York State Department of Health, students and staff are required to be masked when indoors this year. I know that there are many people who will be disappointed to hear this, but it's a consistent message that we've heard through the CDC, the Erie County Department of Health, and then again at the end of last week, New York State came out and said that they were communicating a directive that schools were to be masked when students and staff are indoors. When students and staff are outdoors, it is recommended that they be masked, but it is not required. So when we think about athletics, we think about recess, we think about maybe a PE class or a teacher who's taking their class out for a lesson. Again, it's recommended but not required that they mask when they're outdoors. We know that it can be tough to wear a mask all day. I'm included, as we're masked up back here at school currently in Clarence. And so those mask breaks are really important. What the CDC is recommending is that approximately once every hour or once every period, that teachers build in a 5-minute mask break. And they did give some guidance with spacing, saying that if you're in a classroom and there's 3 feet of space between students, to perhaps alternate rows so that kids have a little bit of extra distance between them when they're taking that 5-minute mask break. And so that is something that our teachers, our faculty and staff will be building in this year, much like they did last year when we had students in the buildings. There is some guidance on type of masks, and you'll see that noted on the slide at the bottom. So what we're requiring are the 2-layered masks, surgical mask, a KN95 and N95. So those would all work. Some of the things that wouldn't be acceptable, bandanas, gaiters, and clear face shields. And again, these are all outlined in the Erie County Department of Health. We did have a couple questions from parents or staff members, students that had used the Google Form survey. Someone asked what happens if folks won't comply and won't follow the mask mandate. And this is one, we're a public school. We want to make sure that we're doing things that are safe and healthy for kids. But at the end of the day, because we are a public school, we're required to follow the health guidelines from Erie County and from New York State. After talking with administrators and teachers, it sounds like our kids did a great job last year when they were masked in school, and that they just want to be back. They want to be in classrooms. They want to be interacting with their peers, interacting with their teachers, playing sports, engaged in the arts. And so they did a great job, and you really get used to wearing face coverings. And so it wasn't an issue, and we just assume that it won't be an issue this year, and that people will accept that for us to be back in person 5 days per week, we need to use that as a health intervention at this point in time. So again, I know that this is a hot button issue for a lot of people. At some point, I hope that the conversation broadens to a certain degree. Right now, it has been really framed as a yes or no with regard to masking. But hopefully over the course of the year, the conversation broadens and deepens, where we're talking a little bit about masking as it relates to other interventions, masking at different levels, or vaccination status, and the conversation can become a little bit more nuanced. People have asked about metrics that will be used. Again, those are things that the CDC, the Erie County Department of Health, the New York State Department of Health, they're the specialists, they're the folks that have that professional training. So we're really going to rely on our partners and again, appreciate their communication and their work getting us ready for a safe start to this school year. So talking about another intervention, to talk a little bit about physical distancing. If you remember last year, a lot of the classroom spaces were set up where there were 6 feet of physical space, physical distance, and classrooms in different areas around the building. After looking at data and research, that number has been adjusted. And so the recommendation for school districts right now is that as we set up classrooms to build in 3 feet of physical distance. And so that's what we have done in our classroom spaces and also in our cafeterias. So we're following the guidance here. Someone had put a question in the Google form saying, how do you measure the 3 feet? And what we've done is just measure head to head as we're building in those 3 feet of space between students. It is noted in the guidance document that when you think about the adult that's working with kids, is that there needs to be 6 feet of space between the adult and between the student. And when adults are interacting and meeting with one another, they need to follow a 6 feet of physical space. So we've taken that into account when we're thinking about things like classroom arrangements, meetings, professional development, so that we can follow the guidance, not just for our students, but also for our adults. There were a couple other questions that were asked. Someone had submitted a question saying, how about the hallways? We know that last year there was reduced capacity. There were arrows set up directing traffic flow. And what we really have found is that when talking with our health professionals, they're more concerned with the close contact, the unmasked contact. And so passing by students in the hallway, that doesn't make them quite as nervous or concerned. And so we've taken down the tape or the signs indicating traffic patterns. So we will just have normal flow when we think about students moving from class to class or moving from, in our elementary school, maybe from the classroom to specials. We will have lockers. And so our secondary administrators have been setting that up for the start of the year. A couple people asked about the polycarbonate barriers. If you remember at the beginning of last year, I believe there were polycarbonate barriers between students and teachers and classrooms. This is an example where the CDC and health professionals, they've been looking at the science and the data, and they haven't found them to be an effective intervention. And so they're no longer recommended when we look at the guidance documents. And so if you remember last spring, the polycarbonate barriers were taken out of classrooms, and we haven't put them back in. And again, because there's very little evidence from the public health officials that they were effective. And we also know that it seemed to create some space and a barrier between kids who we want exchanging ideas and developing a sense of belonging in classrooms. So we won't have the polycarbonate barriers. So we also wanted to talk a little bit about health checks in the morning. And so if you have read through the guidance from the Erie County Department of Health, they are requiring that faculty and staff, as well as students, continue to complete the daily health checks in the morning. And so if you recall from last year, there was a Frontline app where you would respond to a series of questions and you would do a health check with your child before sending them off to school. We're going to have that same expectation, that same intervention this year. I just met with our tech department earlier today, and they're just doing one last pass over so that we send it to an updated list of families, faculty, and staff. And so later on this week, I'll pass along more detailed information on how Frontline works so that you can have the app up and running. We also have a requirement in the Erie County guidance that when students come to school, they have their temperature checked before entry. And so this is something that kids would be used to from last year. They'll come in, there's a quick temperature scanner, there's a monitor there. If they have any questions or bump into any issues, it takes a quick temperature, and then as long as they're healthy, they're on to their first period class. So we will have those up and running again. And again, it was something that we found pretty easy as kids and faculty and staff were coming in the building last year. So that's a requirement. And the same thing when we have visitors or people coming into offices or classroom spaces, they also would go through a daily health check and answer those same questions, just so that we make sure that we're staying as healthy as we can. I did have one person submit a question, and they said, what's the penalty for not filling out those health forms? And after talking about it, most people recognize that this is just a good daily reminder that we need to be aware of how we're feeling, how our kids are feeling, and we need to do those checks before we send them off. We really are a school community. We want to make sure that we're taking care of ourselves as well as one another. And so we just are appreciative that you're willing to do a really quick health check before you send your sons and daughters to the bus or drop them off at school. So we will still have the daily health screening. And again, I'll pass along additional information by the end of the week so that you can be set up for the start of school next week. With regard to the cafeteria, we had been using some anticipated guidance over the summer with our scheduling and our cafeteria setups. And so what we had seen was 3 feet, 3 feet, 3 feet. And so we have set our cafeteria spaces up at 3 feet of space between students. When kids are eating, they can take their face coverings off. And what we'll do, especially at the secondary level, is give kids a chance to settle before creating those seating charts, just so we know where students are on a daily basis for contact tracing. So again, we'll give students a chance to settle. They'll have 3 feet of space. I did have someone reach out with a question. They said, what if I'm really uncomfortable and I'd prefer 6 feet of space as opposed to 3 feet of space? If that's the case, I would just recommend that you reach out to your child's building principal. And I believe they have set aside some additional space where there can be more than 3 feet if people are really concerned about that. There may be some cases where if the cafeteria space is too limited, where there would be some overflow seating and additional learning spaces or classroom spaces. But we hope to get most students in our cafeteria. Just as a reminder again, that the United States Department of Agriculture grant funding has been extended so that breakfast and lunches are free for any child who wants to eat at school. And so we hope that your kids will take advantage of that. And a great opportunity. And again, just wanted to touch base with folks that there will be 3 feet of distance in the cafeterias. And maybe one just quick note, if you're somebody who follows school developments really closely, you would have seen a release on Friday evening that indicated 6 feet was needed. And so there were panicked administrators around New York State because they hadn't planned in a lot of cases for needing that much space. And a short while later, and then again over the weekend, was just reiterated that the spacing wasn't to prevent students from coming back full time and to honor the CDC guidance that indicates 3 feet of space as being appropriate for breakfast and lunch for meals in cafeterias. So just wanted to give a little bit of information there. Thinking also about transportation, we appreciate all of our parents that helped with pickup and drop off last year just to reduce density and capacity on buses. This year, you should have been getting some information from our transportation department. We will be bringing students to and from school. The requirement, though, will be that they have to wear face coverings when they're on public transportation, which school buses are. If there are opportunities where kids can sit with family members, that would make good, safe sense. We will be developing seating charts, but there will likely be more than one child per seat, just in order to get all of our kids here for that in-person learning every day. So school buses will be up and running. Kids will have to wear face coverings. We'll put together seating charts so that if we need to do any contact tracing, we have those documents to help us in that process. So speaking of contact tracing, just to give you a little bit better sense of what it looks like at the school level. So if we do have a positive COVID case, then we would help the Erie County Department of Health in their contact tracing process. I want to emphasize, though, that when we talk about contact tracing and we talk about quarantining, we are relying and we are looking to the Erie County Department of Health for guidance. That's the organization that has the ability to place people in quarantine or to release people in quarantine. That's not the responsibility or something that a public school system is able to do, but they do ask that we help in that process. So if we do hear that there is a positive case, we'll go through the contact tracing process. What we're looking for is, did we have students that were within 3 feet of each other for more than 15 minutes over a 24-hour period during the infectious period before someone tests positive? So again, we're looking for students that had more than 15 minutes of 3 feet or less contact with someone who tested positive. And so in order to determine this, we have our nursing staff, our administrative staff. They're able to look at things like video from the school, to look at seating charts, to talk with teachers and talk with students about who might fall into some of those guidelines, having that close contact. They will submit information to Erie County and the Erie County Department of Health. At the end of the day, they will determine who they think needs to be quarantined and who they don't think needs to be quarantined. Again, if they have questions, we're here to help answer them, but they're the organization that is responsible for making those quarantining decisions with regard to close contacts. If your child is placed in quarantine, the Erie County Department of Health will do the notification. Just one note, and I think that most folks saw this in the Erie County Department of Health guidance and then also in some information that the school had sent out. If your child has been vaccinated and they are identified as a close contact, they would not be placed in quarantine. They wouldn't need to quarantine. If your child is not vaccinated and they were identified as a close contact, then Erie County likely would place them in quarantine. So that is a difference, a distinction based on vaccination status. So that would hold for students. It also would hold for faculty and staff. And so again, that quarantine period, typically being 10 days after that infectious contact. So talking a little bit more about vaccinations, and again, I've had some email conversations and phone conversations. I know that this is an important decision for families when we think about vaccination. I had participated in a webinar a week or two ago with Erie County, and they put up a slide that had vaccination rates in Erie County. What it looks like at this point, so this is not Clarence specific data, but what it looks like in Erie County is that for school-age children who are eligible to be vaccinated, somewhere between 50 and 60% of those eligible students have been vaccinated. When we look at the windows where probably most parents would fall with regard to age, it looks like somewhere between 2/3 and 3/4 of Erie County parents have been vaccinated. So we do know that a number of people in our school community, also our larger community, view vaccination as an important intervention that can likely allow us to get back to a more normal school, to athletics, to extracurriculars. I do just want to note that the CDC, the Erie County Department of Health, the New York State Department of Health, the American Academy of Pediatrics, they are all recommending that eligible people receive the COVID vaccine. I think all of those groups also would recommend, as would the school, that if you have questions about whether vaccination makes the most sense for you or your family, that you reach out to your healthcare provider, to your physician, and talk about the decision with them. So again, we know that a lot of folks in our immediate community that in our county have looked to vaccination. We know it's a big decision. Had just shared some of the recommendations from different groups. And again, would encourage you to talk with your physician if you have any questions. Maybe one final note. If you did a close read of the Erie County document, it does say in the vaccination section that they are asking that schools promote vaccination as a way to get back to more regular, more normal in-person learning. So just wanted to share a little bit of information about vaccination. If you or your children have not been vaccinated and they are interested, I have included a link down at the bottom. I think you can also just do a search. If you Googled Erie County and COVID vaccine, and pretty easily you can find a page that will give you some information on specific vaccination sites. I've had a number of people reach out asking about classroom volunteers. When we think about this school year, a major focus for us has been, how do we make it as normal as possible? We want to have kids participating in clubs. We want to have them back in school. We want to have them playing sports. We want to have them going on field trips. We want to be celebrating those things like homecoming in as normal a way as possible. When we look at the guidance, classroom volunteers, it's not that we don't want to have classroom volunteers, it's that our classroom spaces, when you put in 20 to 25 students, oftentimes with those 3 feet of space, and then a teacher, sometimes a co-teacher or a support staff member needing 6 feet of space, eventually you run out of real estate. And so what we have talked about right now is to really limit classroom volunteers for the start of the year, to get up and running, to get our spaces and our interventions, our protocols worked out, and then to revisit the conversation around the beginning of October. And again, we know that sending your son or daughter to school, this is a parent activity as well, that you want to be involved and you want to be participating in their experience. We want that. We know that it goes hand in hand with a lot of traditions that have been important parts of Clarence experiences for years. And so we want to get back to that. We just want to make sure that we don't go against any of the physical distancing guidelines in the meantime. So again, we will start the school year without having parent volunteers in classrooms, and we'll revisit this as we get toward the beginning of October. So talking a little bit about some specials, so not just a traditional general education classroom setting. I've had a number of people reach out about PE and just saying that it's so much different when their kids can come to school, they can have movement in their day-to-day periods. And so wanting to know what PE would look like. So just want to thank Mr. Lembeck for all his work with our PE staff getting ready for the start of the year. We are committed to a normal and a regular PE experience. If kids are inside, they will have to be masked. If they're outside, masks again are recommended but are not required. We will be using those PE locker rooms so that kids can get changed for their PE experiences, and they'll get some more specific information from their teachers on how to get changed safely and how to get right into activities for their PE classes. And again, PE teachers will build in those same mask breaks so that students can have a break from their face coverings. I did get probably 3 or 4 questions asking about swimming for our secondary students as a part of PE. And again, had talked to Mr. Lembeck, and one of the things that we had discussed is at this point in time, let's get back up and running with more normal PE experiences. Let's get some feedback. And once we get into the year, then we can look at swimming. You know, when you build in swimming as a PE activity, you start to build in different locker rooms with different spacing. And then obviously you wouldn't have a face covering on when you're in the pool. And so there are just a couple different variables that we want to work through. So stay tuned on information for swimming and PE. Again, we're just excited that we can get outside as much as possible. We're hoping for a beautiful fall so that we can be out on our athletic fields and engaging in PE that way. So related to physical education, just thinking about athletics. So we have had our Red Devil athletes back in action now for over a week. Can't wait to get outside and watch our athletes in action. So just a couple reminders about athletics. When students are competing for sports, they don't need to have their mask on. When they're not competing, and maybe they're going in the locker room or they're walking through the hallway on the way to the weight room, they do need to have their face coverings on. Last year, my understanding was that there were limits on the number of spectators that could come to different events. What we're planning on this year is to not have limits on spectators. But if spectators are coming on to cheer on their son or daughter in volleyball or swimming and they're indoors, they will have to be masked, and we're recommending that they maintain a social distance in our athletic spaces. So again, spectators who are indoors to have face coverings on to honor those physical distancing guidelines so that they can be comfortable and the folks they're sitting next to can be comfortable, but not needing to have spectator limits at this point in time. Maybe one quick reminder would be when we have parents and visitors on school grounds, that they fall under our district code of conduct. And so when you're on school grounds, you're attending an event, again, you would need to follow our expectations. And when you're indoors, those masks are important, as are the distancing requirements. So we would ask that people follow those when they're indoors. For outdoor athletics, if we're talking about cross country or soccer or football, again, we don't anticipate having a limited number of spectators. Masks are recommended but not required, and would just encourage people to use the physical distancing that makes them comfortable. But again, we want to have our parents coming out to cheer on our athletes, and we want to have our peers doing that as well, as they can cheer on their classmates. So we hope to see you soon cheering on our Red Devil athletes. So talking a little bit about music, and there are going to be some grade level or some learning level distinctions. So if you have a student in one of our elementary schools, if they're taking a general music class or a chorus, so they're doing singing, they would be spaced 3 feet apart and they would have a mask on. If they're playing a band instrument, they would be spaced at 6 feet. And so this is at the elementary level. So elementary school students, if they're singing, 3 feet of space with a mask. If they're playing a band instrument, they would have those 6 feet of space. For our middle and high school students, they would be spaced at 6 feet apart. And that way they wouldn't need to have a mask or a bell cover for their instrument. When they're not practicing or performing, then they would have to put their face covering back on. But again, this gives our faculty and staff the ability to see how they're using their mouth, how they're using their vocal cords as they're singing and as they're performing. So again, there are some spacing differences. They're on this slide. They're also in some of the guidance information that we'd sent out earlier. I just want to thank Mr. Vitello for all of his support as we've worked through some of these differences, because we know what an important part of a learning experience music and the arts have. Maybe one last note that didn't pop up on a slide, and even before a comment about partnership and thank you. If your student is placed in quarantine, again, our planning has really focused in-person learning this year. So that's where we've put our time. That's where we've put our planning. Last year, you'll remember having a hybrid option for kids. So this year, there is no hybrid option. If your son or daughter is placed in quarantine, just if like they were sick or traveling in a previous year, the teacher will send out asynchronous learning materials. So they would be able to work on those different learning experiences if they're out. And then when they come back, if they need additional support, they would just touch base with their teachers and we can pack that support around them. I would also encourage you, if your child is in quarantine or they're ill and they miss a period of time and you feel like they're falling behind or you have some questions about the learning experiences, please don't hesitate to reach out to your child's teacher. Communication now is more important than ever. And we would just encourage you to shoot an email, to give a call so that we can work through some of those details. I'd also encourage you to reach out to a building principal if you have questions or comments about asynchronous learning or getting the supports that your son or daughter needs to be really successful. And maybe that's a good place to end our conversation today. It's just that we all want the same thing. We want a really safe and dynamic learning environment for our kids. And we know that when we talk about the Clarence school community, we're talking about faculty, we're talking about staff, we're talking about students, and we're also talking about our parent community. So to our parents and guardians, we are so thankful for your support, for your partnership, for your patience over the summer months as we put together our planning. We look at the most recent information so that we can pass that along to you. And again, I want to reiterate that a lot of the communication you've gotten from me, it deals with opening and it deals with COVID protocols because I know that's on your mind. If I were a parent, I know that it would be on my mind as well. When I come back inside to our learning spaces and I'm interacting with new teachers, I'm meeting with administrators, I'm connecting with faculty, they're talking about the learning experiences that they're planning for kids. They're talking about coaching and setting up clubs so that our students really can have a world-class education as they have for so many years here in Clarence. So we are thrilled to welcome your sons and daughters back, not this week, but next week. It really is going to be a great year, but we know that it takes everybody in the community pulling in the same direction. And again, just want to thank you for all of your patience and all of your support. So again, I appreciate you taking the time to log in and follow this Zoom webinar today. If you have any questions, please feel free to reach out to a principal, to myself, and we'll try to get you responses. But again, as we get a little bit closer, you should continue to get information from your child's teacher, from your building principal, and hopefully people are feeling safe and comfortable and informed as we start the 2021-2022 school year. So again, I just wanted to say thank you for logging in today. It's been great over the past couple weeks. Getting to meet some members of our Clarence school community who've come out to different community conversations, different meet and greets. If we haven't had a chance to meet yet, and we bump into each other at an athletic event or a concert or out in the community, I hope you'll stop and say hello. I'm thrilled to be here. Again, Matt Frahm, the new superintendent, and thrilled to be a Red Devil and looking forward to meeting in person. So stay healthy, be well, and let's have a great school year together.